Okay, so welcome again, everybody, to Gray Matters. My name is Sasan Soldozi. I'm the pre-resident fellow working here for the Department of Neurosurgery. So here's our tentative schedule again. Every second Tuesday of the month. Last month we talked about, we gave an introduction, what is neurosurgery, and for this month, I think is very important topic, and it's regarding getting involved in research. This is a question, without fail, I get asked all the time. Medical students always are wondering how to get their foot in the door. Okay, so today our talk will revolve around one, how do you get involved? And not only that, a lot of students get involved, but they don't do a good job. So how do you stand out? How do you actually do exceptional work that will impress the residents, impress the attendings, so that you have a stronger CV moving forward? Um, and then I'll talk about how you can sort of move away from this thought process that, there are no projects available, nobody is emailing me back with projects. I'm going to give you guys my formula for how I created my own projects. And this is really the secret to being so productive. You're not relying on someone else to feed you projects. You can just do it yourself. And then I'll get into how to write a systematic review and meta-analysis. That's what this stands for: systematic review, meta-analysis. This is, the secret sauce for initiating your projects, and I'll get into more detail. And then, of course, I'll go over, our interesting case of the month. So getting involved. When I was a med student, during my third year of med school, during clinical rotations, I published over 20 papers, and I graduated med school with, something like 30 something papers, and there was no gap year involved. Short of hard work, there was a strategy I used, and I'm going to convey that strategy in this talk. But just to give you guys sort of a reference point, when you apply for residency, you're going to see that, the average number of research items is about 23.4 for each applicant. And this is in the charting outcomes. I don't know how familiar everyone is with charting outcomes, but this number is extremely inflated. It includes abstracts, presentations on top of publications. And actually, you can include papers that are under review. So these are papers that are not even published. So all of these make your application essentially severely bloated. So you can really pad this number. And, whether that's right or wrong is a different conversation, but obviously, if you have a high number of abstracts, presentations, it can really raise this number, even if you only have 3 pubs. But a lot of programs read more into your application than you think and can quickly identify folks who have 15 pubs and maybe 3 abstracts versus 15 abstracts and 3 pubs. Obviously, having more pubs is ideal. So most students, and there's a manuscript on this, if you search in PubMed, or Google it, number of research papers for neurosurgery applicants, I think there are several papers on it, but most have less than 5. This is the norm. Not every med student is think about it, the top 20 med schools, top 30 med schools, that's only 30 med schools. The majority are not in these med schools with very strong powerhouse programs. So even getting a few papers is an accomplishment for them. And then, of course, less if you're a first author. Now, the story changes. You're in a different sort of rat race, so to speak, when you're at a productive home program. So I went to the University of Virginia for med school, and they really pump out a lot of research. So if I'm a home student at a place like, Miami or UVA or, a big name place, and I only have 5 papers, or maybe only like 3 to 5 papers, it raises, eyebrows. It's like, why did the guy from a very rural, unknown home program publish just as much as somebody from a powerhouse program? So in one way, the advantage of going to a big name place is that you get the reputation, the prestige, but now expectations are higher. You have more opportunity and there's no excuse not to take advantage of it. And then, we get into the elite applicant. I mean, every year there's about 20 or so people who have 50 plus pubs, maybe even close to 100. And these are, typically unique circumstances. These are foreign graduates who already completed residency. These are folks with PhDs. At a certain point, you have to understand you can't compete with these people on a not strictly objective basis. They will have more papers than you, and if they're a PhD, it's going to be higher quality papers. The point is not to try and be better than these people, because you can't unless you put in those extra years. But how do we maximize your potential as a medical student if you don't want to do a gap year or do all of these extra hoops that unfortunately IMGs find themselves going through? So in general, I mentioned this in the intro talk, you have to start early. Even if you're on the fence, just start doing research. It doesn't matter, because if you decide to do something else, no one will question why you did neurosurgery research. And not only will it help, build your CV early on, but you can decide for yourself, do I enjoy writing these papers or not? And one thing, before I go on with the rest of this talk, is you have to be ready for rejection. Your first paper is not going to be good, or rather your first draft. It's going to get torn apart. You're going to revise it, think you fixed it. It'll get destroyed again. Finally, after many rounds of emailing, you're going to be ready to submit. And then you get this page of revisions, if you're not outright rejected, saying how terrible your work was. And over time, it wears down on you and you almost become discouraged, but you can't let that happen. So one of the residents, his name's Victor Liu. I think now he has 140 papers. This is not an exact quote, but we were just recently chatting, and he said how everybody is focusing on his high number of publications, but nobody has any clue how many times he's been rejected, how some papers took 5, 6, 7 rejections to get published. So this is not for, faint of heart. You're going to get rejections, and you have to be able to handle criticism. That's the only way you'll get better. So what do you do? How do you get on people's radar? You got to email. We're in the information age. Email is the king of conversation here. So email, attendings, residents. Look up online, how to ask about a research project, but keep it short and sweet. Dear Dr. X, Y, and Z, my name is blank. I'm a third-year medical student interested in pursuing neurosurgery. I was wondering, I was wondering if you had research projects available for me. And one, thing that will look good is if you actually look into the research an attending has done or a resident has done and say, hey, I read your recent article on XYZ topic, and I'm very fascinated by, the glioma technique that you describe here. I would love to learn more. That will set you apart rather than saying, hey, I'm a med student, give me a project. Honestly, nobody owes you anything, right? So it's you got to show interest, get on people's radar. And some residents and attendings are more amenable to mentorship. So you also a little bit of serendipity and luck. Now, the biggest question I get is, what if I get no response? So, as a med student, you think you're busy. I remember thinking how busy I was, but then once you get into residency, it's just a whole other level that you just will never understand until you're there. Even as a sub-I, a lot of your time is just, you're just kind of this standing there, and you won't understand till there's responsibility on your shoulder. With that being said, you need to follow up. Personally, I love when a student, texts me or emails me and say, hey, by the way, did you get my email? Because immediately I'm reminded and I can take care of it. If not, I'll just say, remind me again in a few days, I'm getting destroyed. Like, so, and I think yeah, exactly. You're not being annoying. Just understand how busy everybody is. And again, I personally appreciate it. So if you don't do any of these things, projects aren't going to just come to you. You have to build those connections. So here's an example of a follow-up email. Dear Dr. So-and-so, I'm emailing to follow up on my previous email below regarding, research. I understand you're very busy. I look forward to hearing back from you. Sincerely. That's it. That's all you need to say. Don't write, too much. Again, they're very busy. And if they have something for you, usually people respond once you follow up. If they have something, they'll give it to you. If not, they'll politely, turn you away, which is no problem. And if you still get no response at that point, maybe, do like a second follow up. But after that, if you're getting radio silence, move on. You need to, time is money here. So that's sort of getting involved, right? You got to email. You got to just really be persistent, if not a bit aggressive with your tactics, and make it personalized. Don't just send like a whole swamp of emails. I mean, everybody is friends with each other. They're going to know like, oh, you just sent a mass email. So how do we stand out? You got a project. Somebody emailed you and said, hey, I got a paper idea. Here's what I want you to do. Number one, get it done fast. Get it done fast. I mean, this is the number one thing that impresses me is not so much, especially if you're just starting out, like the quality of work, which is important, but can you just do what I asked you to do and just get it done? If somebody says, oh, maybe this is going to take a month or 2 months, imagine, how impressive it is that you got it done in a week, and easier said than done. I mean, I know when I was a third year, I would come home, on my, let's say, surgery rotation, it's like 8, 9 p.m. You're studying for shelf exams or step 2 or whatever. That's, to me, if I see a student in the middle of third year and can turn around a project in a week, it shows this student really is committed. I mean, you're willing to sacrifice sleep, or you're good at multitasking and organizing yourself. So that's step one. Just get it done fast. Step 2 is writing good quality work. Now, this is, take this advice with a grain of salt. If it's your first paper, this isn't, how do you do this, right? You're a med student, you've never written anything in your life. And the answer is actually quite simple. You got to read. You got to read. So going back to step one, turnaround time, most of your time should be reading the literature. Whatever the topic is, let's say they give you a topic about, a pituitary tumor, and the topic is, I want you to compare resection of pituitary adenoma with endonasal approach through the nose or transcranial approach. You need to read every single paper that exists. Well, you know what I mean, but read as much as possible and look at the format, look at the structure. What do they pay attention to? A lot of outcomes for pituitary surgery, we focus on visual deficits. We focus on endocrinopathies, if they're hypopit, if they need hormonal replacement, all of these things, you pick up on them. You pick up on patterns and read the references. See, a lot of the times these papers sort of cite the same landmark papers. You need to know the big papers to have a gauge of what you're writing. And then as far as quality goes, pay attention to the language, the sentence structure, the semantics, and overall the manuscript structure. Really break down a paper. And if you're somebody who has basic science experience, you're good at that. You know how to break down the methods and sort of what's in scientific writing in general. And obviously, this changes depending if it's a review or a case report. Each one has their own style. And then you got to find out your target journal. When students ask for projects, I give them a project, but it's on you to ask, hey, what journal are you thinking? Are you thinking World Neurosurgery, Journal of Neurosurgery, Neurosurgery? It's a journal, clinical neuroscience. What is our target? And then you can quickly go and see the instructions for authors and then format your paper. So you're not wasting time, okay? And then look at papers that were published in that journal as well. And then this way you can really break it down, from word count to, what do they want? How do they want their methods splayed out? What is the formatting, the reference, the citations? A lot of these things are outlined. So a lot of the questions I get from students is, how do I even get started? How do I structure? Like, I don't know any of this. It's all there, and find out what journal you guys are targeting and dig, do your research. And you can find the pattern in the similar topics and go from there. And then, another thing that stands out to me is if a student reaches out to me with their own ideas, and this is where you're demonstrating a higher level of thinking. And so when I started doing this myself as a med student, multiple times feedback I received from attendings was, I'm very impressed, that you're able to critically analyze the literature and identify gaps in the literature. This may take a few projects. If you write a bunch of projects on aneurysms, you're going to start noticing things that are lacking in the literature, and then you can start sparking ideas. But there's also a little secret. It's not really a secret, but it's call for papers. If you Google, call for papers neurosurgery, you'll see there are journals soliciting topics for you. So you don't even need to really create your own idea because it's already been outlined in some journals. So what do I mean by this? So we'll go right here. I even have it already loaded up. So here is neurosurgical focus call for papers. You can Google this and find this page. And already they have the topics for 2022. So for example, the deadline for this paper is coming up October 1st. We will be published in February, and it's called an update in neuroimmunology. And here you can read the more in-depthly what they're looking for. And it even says explicitly, this issue is seeking original work, which for a med student is not very feasible. You have to join a lab, clinical research studies, manuscripts. But really, you can write a systematic review, or which I'll explain what that is if you don't know, on this topic, and they'll accept it. Most of the time, they'll accept the best systematic review they get for an issue. And then here, vasospasm, big data, looking at like neurofibromas, NF1, NF2, telemedicine, AVMs. These are all potential research topics. Now, one thing I want to say is a lot of my papers I've submitted to this journal have been rejected, but subsequently they were accepted at World Neurosurgery. So even though my primary goal was to, let's say, submit to this topic and get it accepted, you still have a good paper on your hands with a topic that's clearly timely, because why would a journal solicit topics that are not something that is important or, needing more insight from a research perspective? So let's see, going back to the PowerPoint. If you're looking for an idea, you gotta go for the call for papers, and then read the little subheading for more information. So, like I said, neurosurgical focus is your biggest friend. And if you look at the papers that are consistently published there, the first author is typically a med student. You can tell because the degree says, Bachelor of Science or Bachelor of Arts. And a lot of this is how I got my start, honestly, was neurosurgical focus. So what exactly do you write? That's the question. Now I have a topic. We just saw update on immunology. We saw vasospasm. We saw arteriovenous malformation. So now we have an idea, but what do we do with the idea? And this is where I think, the magic of a systematic review. Because a systematic review follows a formula. And basically what it is, it's a review article on a certain topic that follows a structure, a specific search strategy. And the easy thing is you're just following a checklist. And so here's a screenshot from the PRISMA website. Again, just Google PRISMA systematic review and go to their website. And PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. Every journal will ask you to submit a PRISMA guideline checklist. And so before getting more into detail about how to write one, it may be confusing. What is a systematic review? What is a meta-analysis? And what is a normal review? Or also known as narrative review or non-systematic review. Just a regular review. What's the difference between all of these? So again, systematic review, as the name implies, is systematic. It's structured. We follow a very formatted search strategy that follows the PRISMA guidelines. And basically you answer some sort of question and you extrapolate from whatever's in the literature. Now, a meta-analysis takes a systematic review a step further. It involves more data. You're taking actual data, you're pooling it or combining the data across multiple studies, and you use statistical analysis software to generate a pooled statistical metric. So for example, if I have 10 clinical trials comparing drug A and drug B, for some sort of outcome, we can actually combine the results of all the clinical trials with a meta-analysis to create something even more powerful, statistically more powerful than a single clinical trial. And so we can make a judgment and say, by and large, by combining all 10 clinical trials, drug A, is superior to drug B in achieving this outcome, or we can say there is no significant difference. And so meta-analyses are exceptionally powerful and are a lot more work for that reason. So in general, meta-analyses are systematic reviews, but with that extra, icing on the cake, extra step. But not all systematic reviews are meta-analyses. So you can do a systematic review and purely describe the literature from a qualitative rather than quantitative standpoint. And then lastly, what about a normal review? This is just an unstructured review of a topic. It doesn't have any search strategy that's been formalized or set of guidelines. And typically you're invited by a journal. If you're a big name in the field, journals will solicit articles from you because you're the head honcho, right? You're the expert and they value your word on a certain topic. But I've had good success writing my own review articles on things I have thought of, and it gets accepted. If it's a unique enough topic, it gets accepted. So here's a screenshot of a portion of the PRISMA checklist. And it seems very, very busy, but it's not as involved as you think. Step one, title, identify as a systematic review. It's that simple. Abstracts have a certain format. In the intro, you're supposed to describe why you're doing this. I always write in my introduction, the purpose of this systematic review is to survey the literature and compare endonasal approaches versus transcranial approaches for resection of pituitary tumor. That's it. Provide an explicit statement, and then I could get into more detail specifically to analyze outcomes, including complications, morbidity and mortality rates, etc. And then in the methods, you need to define criteria and your search strategy, which is here. So my search strategy would be pituitary adenoma, endonasal approach would be one search, and then pituitary adenoma transcranial, approach would be another. That's a very simplified strategy. And then you want to do criteria. I want articles that only include, patients above the age of 18. I want articles that have at least 1 year follow-up. I want articles that explicitly have this and that and this. This is where your freedom of thought, you're free to define your own strategy, especially if nothing similar has been done. Just come up with it yourself. Just do what seems logical. So this is your checklist. And if you just follow this, you're going to be a PRISMA certified paper. So I have some examples of my own papers. So we'll look at an example of a systematic review and then a narrative review. I don't know why this is doing it like this. I should have it up. So, we'll just search me on PubMed. And let's just pick, here we go. Here's an example, endoscopic endonasal surgery outcomes for pediatric craniopharyngioma, a systematic review. And we'll see that there's a very specific format, and I actually have a template for how to write these. I'm gonna, have that emailed out to the interest group for you guys. But basically, I follow the same formula every time. The abstracts follow, these headings: objective, methods, results. The goal was to systematically review X, Y, and Z to assess this. The method: we performed a systematic review using these databases. All studies used, following my criteria were included. Boom. Results: we had this many studies, and then a little short sentence. Conclusions: what did we find out? I mean, it's extremely simple. And methods, again, you can use my template I'm going to send you, but I basically write the same thing. A systematic search was performed using X, Y, and Z databases using these terms. And then this is really what sets a systematic review apart from a regular review, is this flow diagram here that you guys see. So when I did this search, endoscopic surgery, pediatric craniopharyngioma in PubMed, I got 48 hits. So what I did is I excluded some articles based on just the title and abstract, and I have my criteria, case reports fewer than 5 patients, review articles, editorials were excluded. So, and generally I use the same exclusion criteria across the board. I mean, I don't want other review articles. I don't want small sample sizes. I mean, it's just obvious things. Then I actually read the article in depthly, or take a closer look, and then further exclude if some things are not really revealed in the title. And then boom, I have 13 papers for qualitative synthesis. And I always do a nice table. I always include a table that's the author, general things, the number of patients, et cetera. For this is specific to pituitary disease, maybe some comments. And so this table has all 13 papers. And then I summarize the findings of each paper in a little paragraph. And then in the discussion, I synthesize the data qualitatively. So this is a systematic review, no meta-analysis. I did absolutely zero statistics. All I did was talk. I just talked about what I saw in the literature. It's something that's important is, always include limitations. Generally, they're the same. Selection bias. You may have missed some papers based on your strategy. And also write, why didn't you do a quantitative analysis? And I wrote, because of the heterogeneity. So that's very, very brief look at, just a normal systematic review. Here, here's a paper, by the way, that was published in Focus. Here's another one I published in Neurosurgical Focus that I did with Dr. Park. He's an endovascular surgeon. So now we're jumping ship to the vascular world. And this paper just has no strict structure. My abstract is unformatted. So it's just it's not very different, but it's different enough. Like you're just sort of free writing. Introduction. So in this article, we review blank, blank, and blank. I could have made this a systematic review, but for whatever reason, I chose not to. And it's organized almost sort of like a book chapter. You have your heading. So aneurysm morphology, I talk about it. Fluid dynamics is its own topic, and so forth. So you see it's much less structured and almost seemingly random. But once you do your search of the literature, you kind of see, when I did my search, the main topics in hemodynamics and aneurysm formation was fluid dynamics, morphology, hemodynamics. So based on the literature, I was able to make that structure. I think this is harder. Honestly, I think it's harder to write this type of article starting out because it's too unstructured. There's not enough guidance, if that makes sense. That's why I like the PRISMA guidelines. It's just easier, in my opinion. So one thing, a lot of students think whatever they're writing is just, BS. It's not impactful research. It's not, worthwhile. You're just doing it to get your numbers up and, match, right? You don't feel like what you're doing is important, but, I'll show you my citations. My stuff has been getting cited a lot. Since 2019, this paper got 60, this one has over 100, and it was published this year. But that's not a systematic review, but this systematic review just keeps getting cited. Here's that hemodynamics paper, 18 citations. So what I'm trying to say is, not brag that my work is important. I honestly, I didn't think it was important at all when I'm writing it. I thought it was interesting and it was fun, but to my surprise, people are actually reading it and using that information for their own work. So you may not be writing primary research articles like Nature papers, et cetera, but you're synthesizing a lot of information in the literature that helps out scientists and other neurosurgeons to cite your work and help guide their own research. A lot of my papers, at the end of the paper, I sort of say, we need more research in X, Y, and Z domain. Unfortunately, our analysis did not, we were not able to draw conclusions on this topic. Further avenues for research include X, Y, and Z. And people read that and it gives them ideas for their own. And I don't have the capability to initiate, a prospective multi-center, trial or whatever, but, other people can. So people will read your work. I wouldn't worry.
Can I ask a quick question? Just
Yeah,
while we're looking at the Google Scholar. So I feel like a lot of papers in neurosurgery tend to be authored by a wide variety of people, both for the sake of balancing the workload and then also for bringing in different perspectives.
Mm-hmm.
Do you have any suggestions for how to go about reaching out to people and whether it's appropriate for us to reach out to other institutions or hire up neurosurgeons compared to just residents as a medical student?
I think it's absolutely appropriate. And in fact, I encourage it. For example, I came up with an idea. Let me see if I can find this paper. It's 3D printing and craniosynostosis surgery. So I just thought, 3D printing is a new wave. And I saw nobody's writing about it for craniosynostosis surgery. And if you're not familiar with that, it's basically reconstructing the calvarium due to inappropriate fusion of the sutures during development. Let me see if I can find it, if we go by year. Yeah, here we go. 3-dimensional printing and craniosynostosis surgery. So, this was my project. So actually, this is a fellow at when I was at UVA. So this is a med student who I recruited a med student to help me. He's actually, a gen surg intern right now. He had no interest in neurosurgery, but I asked for his help. So I encourage you, number one, reach out to your fellow student. Okay, you guys are in this together. You can split the workload. I told him, you're going to write this section. I'm going to write that section. This is a resident. This is a attending at Mount Sinai. So I actually, on Twitter, I DM'd, I think I DM'd him. I was like, hey, I have an idea for a paper. Would love to hear your input. I know you do a lot of craniosynostosis work. And he said, yeah, here's my email. Send me the paper. So he was involved in helping me out. And then this physician is actually at the Georgetown, George Washington MedStar system. I think he's like chief of pediatrics there. And I actually had him look it over. and it was on the suggestion of the senior author. So yeah, it's very impressive, honestly, for a med student to just cold email and say, hey, I have a sorry.
And on that note, do you get the paper basically in submission form before you show it to any of them?
Yeah, basically have the paper done.
Okay.
Don't email and say, hey, I have an idea, what do you think? I mean, they don't know you, and they're already busy with their own stuff. But if you present a finished project, it shows that initiative. And that's actually, kind of one of my secrets, so to speak. When I was a med student, I just came up with ideas. I would write it all, and then I would just show the attending, like, hey, do you want to be senior author on this? Can you read it over, give your edits, let me know what you think? And then we'd say, hey, let's include these residents, let's include, these people from this institution. It all starts with you having a nice, basically finished product. Does that make sense?
Absolutely. Makes
Yeah, so that's very important. So yeah, is your research important? Again, it depends. You're not going to be doing groundbreaking stuff, but people will read it. People will cite your stuff, except case reports. I mean, it's doesn't really add much, but it's something cool, But obviously we can get into higher level studies, but that gets harder and it takes longer, right? More work, more time is required for higher quality research. We know this. Clinical trials, but a secret, I keep using the word secret, but you can do as a med student a systematic review of clinical trials, right? And if you do high level statistics, if you teach yourself how to do those stats, you can put out a paper, a meta-analysis that combines clinical trials of a certain topic, and suddenly you're the number one person for that topic on that clinical trial. So in a way, you didn't have to do all that work to synthesize the data. That's the beauty of a systematic review. It's a necessary part of research, I think. It can be overdone if it's done on, silly topics or non-impactful things, but in general, yes, don't think of your work as useless. So we've talked about, let's see. So we've talked about getting involved, how to stand out, sort of initiating the project with the call for papers. Now, how do you write a systematic review? What is the process? So I have a Word document here that I actually wrote up when I was graduating med school, and it's not too long. I mean, it's like 6-7 pages, and I want you guys to read this. If you're serious about learning how to write a systematic review, I get into the nitty gritty, like details, exactly how to get started. I have a template document, which I have right here. We go. I have this template. Here's the title page. Here's the abstract template. Your introduction. Always include this at the end of your introduction. The aim of this systematic review is to do what? What are we accomplishing? This, I change the wording and stuff around, but it follows the same structure. You need to define your search strategy. What are your criteria? If you're doing meta-analysis, you need to include all of this, as well as a statistical analysis portion. And then this is what sets you apart, doing a bias assessment, which I'll get into. And then your results include what was your search. We found, our search had 3,000 papers. We dwindled it down to 100 after inclusion criteria. We ultimately landed with 15 articles summarized in table 1. And then that's where you can pull the data. We had a total of, 800 patients. This percent were male, female, they were this age, the typical stuff you want to include. And then your topics, it's just whatever your topic is. So in this paper, I was looking at radiation necrosis. So here's where you'll modify it, of course. And then you have to always include, how did you evaluate bias? And again, it's all outlined in my how-to document. And then discussion. Remind the reader, what was the goal? The goal was to do this. This is, if it's the first time the systematic review on the topic is being published, it's going to probably get published if it's not, if it's good quality. It's pretty much I don't want to say guaranteed, but again. I have, good success with this method. And then always, really, describe your limitations in detail. This is not a perfect art or science. And then that's it. So I'm gonna, not send these out right away. I'll look them over and tweak them, and have these sent out to you guys. And send them to your friends. I mean, send them to the other med students who, couldn't make the talk, and let them know. And I'll have this finished up as well. But essentially, I'll run through it. You need to familiarize with what a systematic review is, which we sort of have done already. Generating an idea. Again, call for papers. That's your ideas are already out there. Actually doing the literature search is the most tedious part, and I outline like word for word, how to do this. I say here, there's no right or way wrong to do it. But you don't want to search something that's like a thousands of articles. You can't. It's too much, and anything less than 10 is just not enough to warrant it. And then I get into using PubMed, how to import citations. Web of Science is another database. Ovid, rinse and repeat with other databases. And then you want to get rid of duplicates. I get into all of this. Literally, I screenshot the Excel sheet. So it's not completely finished, but I will wrap it up and have that sent out. So it would take me too long to talk about it. And you'll forget, most of what I'm saying. It's better to have a how-to guideline as you're writing your own systematic review and follow the steps. And you'll find, and if there's any confusion, reach out. So I actually created this Google Sheets. I know in the past, maybe some of the older med students know that there was some sort of research Google Sheets, but I think it's died down or it hasn't been updated. So I want to bring it back, but in a less overwhelming way. I looked at that sheet and it was very busy, but I want to start by just collecting med students' names, emails, if you prefer texting or whatever, your cell phone. What year are you? And it'll give me a little idea of where you're at. And let me just put this in the chat. Let's see. Let me just put this in the chat real quick. And then, go ahead, click it. Let me know if it works. But essentially, fill out your information and yeah, perfect. So fill out your information. And I really, my goal is to create basically have us be like a publication office. I want to have, 20, 50 papers going at the same time. And I would ideally have, 2 to 3 med students working on a single project at a time. And then you guys can just, swap papers. Say, hey, I'll write your discussion. You write my intro. That way you get each other's names on and everyone's papers, right? So I'll show you again in my own papers. So this guy, he's doing ophthalmology residency now, and we worked on this together. He's a neurosurgery resident at Maryland, and then these are the senior authors, the residents, attendings. But these are my classmates, and we just got together and just put this manuscript in 3 days, right? Let's see, what else? This is my buddy. He's at San Diego for internal medicine. So he didn't even end up doing neurosurgery, but we just got together. And I was like, hey, I have an idea. Let's work on it together. And he wrote most of that paper. This guy, he's a 4th year at UVA. He recruited me to help out. So she's a pediatric resident now at Los Angeles. Again, these are the senior authors. So I always, want to include my classmates. He's a 4th year at UVA. He's a neurosurgery intern at Tufts, anesthesia resident, senior authors, right? So we all got together and all of us wrote the bulk of this paper. And then this is one of my buddies. He's a med student at VCU Medical School. I actually had my younger brother, I had him write, a portion of the paper to sort of get he's applying for med school right now. So the whole point is, get your friends involved, get your classmates involved. I was a very high volume publisher, and, my friend Stephen Young, he's now doing integrated vascular residency. He just wanted papers, he didn't, And a lot of times nobody really cares about the topic unless you're neurosurgery. We want neurosurgery, but moral of the story, power through collaboration, help each other out, create an environment where everybody's helping each other. You don't, some schools are very cutthroat and you're stingy with projects, and it creates a more nasty environment. And I don't like that. I want everyone to help each other. But I also don't want everyone just slapping everyone's names on the papers. There's a balance. So that's sort of wraps up the research talk, and I'll get everyone's information in the Google Sheets, and then honestly, what I'm going to do is just go through the call for papers and just sort of just start assigning people like, hey, you three, you're going to write this paper. Here's a template. I want you to write, student 1, write this section. Student 2, write this section. Student 3, and then that's it. I mean, we can really pump them out. So I'm sort of cheating here. So this is the case from last month. This was the spinal cord tumor. And I re-included it because now I actually have the video nicely edited, and I wanted you guys to see, in real time, what does this kind of surgery look like? And so just so you're oriented, the patient's head is towards this way, the feet are down that way, and then we've opened dura, and we see the spinal cord tumor. So I'll start playing. So right here, that is spinal cord. And this nasty looking guy is all tumor. And so he's dissecting a bit of that tumor out. And this is all done, I should say, under the microscope. Okay, this is all considered microsurgery. We are using a microsurgical instrumentation. And now you see the video is sort of fading into the different parts, but each of these steps is exceptionally meticulous. This was a very prolonged surgery, many, many hours. And you have to be very delicate because, again, I'll pause. All right, let's keep it running. But the spinal cord is right there. If you're doing too many abrupt movements, that's a lot of manipulation on very sensitive and critical neural structures. And here is a sort of, it's a sonic aspirator type of device that emulsifies the tumor tissue and sucks it up. So it's nice for debulking the tumor. And then here, you just piece by piece are taking the tumor away, but being very gentle. And you use a combination of sharp dissection. So here with scissors is sharp dissection. And where you can, you try to do blunt dissection, but sometimes sharp is necessary. And again, he's debulking the tumor, coring it out like an apple in sort of piecemeal fashion, removing portions of the tumor. And now here, the attending is trying to separate the tumor from the cord. And this right here is a very delicate procedure because you're not really too sure how adherent the tumor is to the cord. Some tumors are very just plop right out, minimal manipulation, but here you can tell it's pretty attached to the spinal cord. Again, more debulking, more piecemeal resection of the tumor. And then sharp dissection here. And then, you move on to other portions of the tumor. Again, using the same principles, a combination of sharp and blunt dissection, suctioning, ultrasonic aspiration. A little bit blurry out of focus, but, and here actually is a very delicate portion because you have a vessel loop, and that's all tumor. And so you have to be very careful with how you dissect the vessel loop away from the tumor. And here we have much better focus. And so you can see with the micro instrument, he's trying to sort of feel out and separate the vessel, the blood vessel, away from tumor. And so you can imagine if you take a vessel inappropriately that's feeding the spinal cord, I mean, you can have a spinal cord infarction, right? And we'll skip ahead here. And that's, here, right here, this is all tumor that's just really just stuck to the spinal cord. And we left that behind, you know, at a certain point, we've achieved the debulking, we've decompressed the cord. You know, the question is, how aggressive do you want to be, and how much damage are you willing to tolerate? And in neurosurgery, the answer is often like none. You know, you don't want to paralyze somebody to get some tumor back. The risk being recurrence. Okay. But if it's very slow growing, it's, you know, it's not something to worry about. You just follow an imaging. And then you can see, you know, our spinal cord has been decompressed and, you know, it's bloodless. You know, there's been meticulous hemostasis has been achieved. And then, you know, the rest is just closing up. And so we cut the tack up sutures to release the dura. And then you close the dura under the microscope still in a running watertight seal fashion. Okay. And you can see, you know, it's not that long, but under the microscope, it looks, you know, very substantial. Actually, it is pretty long. It spans several levels. And that's it. So that sort of wraps up the interesting case of the month. You know, I know I cheated a little bit. I didn't use a different case, but I thought the video is cool because, you know, these are rare tumors. And it's always nice to, you know, we always see pre-op, post-op films, but it's always cool to see the actual videos. So that sort of wraps up this month's talk. Does anyone have, you know, questions about research or something you'd like me to clarify before I let everybody go?
I have a quick question. I just want to say thanks for a great talk, Dr. Saldozzi. We definitely appreciate it, and I'll make sure that the word gets out to the rest of the medical students that weren't able to come about the Google Doc and the talk as well.
Yeah, send them the Google Sheets. You know, I'm glad, you know, if it even helps one student, you know, I've done my job.
Definitely. I think this is something that we're definitely going to be really excited about to collaborate. I think it's needed. I just wanted to ask about, you mentioned a systematic review and then going through the papers that qualified with the PRISMA guidelines, not quantitatively, but qualitatively. Can you just speak a little bit more to that? Like what a paper like that would look like? I'm sure maybe it's in the template, but what does a qualitative review kind of look like?
Yeah, so it sounds more abstract than it seems, but with what I mean by qualitative is you're just sort of describing what you found. You're just laying out, you know, what is the current state of the excuse me, what is the current state of the literature? So, for example, let me find something I wrote. You know, systematic review, also focus. I mean, I love neurosurgical focus. It's been getting harder to publish there, by the way. Their impact factor like doubled in the last few years. So a systematic review of stent electrode arrays, minimally invasive approach to brain-machine interface. So for those of you who don't know, a brain-machine interface is a way to, you know, use your brain to control technology. It's, you know, being used to sort of people with, you know, paralyzed limbs. You know, the thought is that you can have them control robotics and use that as like a prosthetic limb. Very, very brief summary of that. But basically a qualitative analysis. So I do my search. Again, it looks very similar to that craniopharyngioma paper. Literature search was using these databases. We found these papers. I have my table. And so what I mean by qualitative analysis is, so what I did, I found, let's say, you know, 20 papers. Let's say like 5 to 8 of those papers talked about a very specific topic. So somewhat, like, let's say 10 papers specifically talked about brain stimulation. So what I would do is, among my total included articles, I've grouped those similar papers under the brain stimulation header. Then another like 6 papers talked about, you know, strictly signal detection and decoding. So I grouped those papers in that category. And then I'm sure there's another. And then, you know, there's maybe 3 papers talked about, you know, what is the optimal catheter. Some paper talked about the electrode. and then some of them actually described clinical experiences. So I group similar papers that describe similar things or outcomes. And then what I do is qualitatively describe it. So I'm just, as I'm saying, I'm just describing the paper. So, you know, endovascular interfaces have been in human subjects. You know, Nakasi et al. They published their findings in 14 people for AVMs or epilepsy. They utilized this guide wire. They did this. And then they've had these findings. And then Stoder and all, they did this. They had these patients. They had these findings. So it seems like you're just kind of, it's not seeming, it's what I'm doing. I'm just repeating, you know, their methods and their outcomes very briefly in my results section. And then in the discussion, I kind of synthesize it. I'll say, well, Nakasi, you know, did it this way, whereas, you know, the other paper did it this way, but both their findings are agreeable, or they are contrasting, but this could be because their methods are different. So what I would suggest is look me up on PubMed and read some of my papers and see how I do this in like an intellectual way.
Awesome. Thank you. Appreciate it.
Absolutely. Okay, so if no one has any more questions, I'll let everyone go. Just, you know, please spread that spreadsheet. I'll have Ingrid email out the spreadsheet link. I'll have her email out the systematic review template as well as the how-to guide, you know, within the next week or so. And then we can really get, you know, a nice system going where we have, you know, ideally 2 to 3 students on a project, all contributing, and then, you know, sharing the wealth, and then we can really go from there. And then eventually I want you guys to have your own first author papers, you know, your own ideas. And maybe you can always reach out to me, say, hey, I want you to help me out. And then I'll say, yeah, you take lead. I'll sort of guide you, but that's for in the future. Okay. All right. Thank you, everybody. Have a good afternoon.